This clip shows some of the preparation with the patient in advance of the exam commencing. The examiner has already rehearsed the scenario with the patient as if they were a candidate. This helps ensure that not only can the patient deliver the history as expected, but that any unexpected queries can be addressed. It is strongly advised that the examiners undertake this dress rehearsal practice with the patient, as well as confirming key points and questions prior to the exam commencing. This helps to ensure that the patient will deliver the scenario in a consistent manner, ensuring fairness to candidates.
Thank you, Mr. Cruz, for coming to help us with the exam.
Thank you.
And I think you already received the scenario well in advance by post, and I'd like to go through this, making sure that what you are saying to the candidate is appropriate.
Good.
And as you know that you are going to give some information voluntarily as soon as the candidate asks you. For example, as I mentioned here, you had a blackout yesterday, and would like to tell me what was the situation at the time when you had this episode?
Well, what happened, and for this practice can ask this, I'm just into hospital. Do you want me to be slow and deliberate and
yes,
quite
please.
Frightened?
Yes.
Right, fine.
Obviously you're anxious about being
that's
a
what I
blackout.
mean. Yes, okay, that's fine. Yeah. Well, doctor, I was sitting in the house reading. Everything seemed to be fine, and I felt slight strange, but nothing significant. And then the next thing I knew, I was on the floor.
Yeah. Okay.
A terrible.
Maybe this is the kind of information you give at the start of the consultation.
That's right.
And unless they specifically ask you whether have you had any sore tongue or whether you had incontinence of urine, unless they ask, you're not going to.
I'm not going to volunteer that. No, I won't volunteer any more than that.
Yes, correct. Yes.
Yes.
And also, they'll go through. What they will do normally is you have a 15 minutes with them, and they will ask you lots of questions. And unless they specifically ask, you're not going to give away anything.
No, we're not giving away any information.
Then they will ask you, are you taking any regular medicines or not?
Yes.
And they may ask you whether you had any past medical problem, etc. Obviously, you had something to tell from the scenario, right?
Yes, I believe a number of years ago I had tests, and I think it was a sort of fluttering heart or something, but it was the arterial fibrillation or something.
Yes,
came over.
Yes.
I think it was that, but it's never bothered me, and nothing's happened about it.
You are doing very well here. That is the way to tell. Yeah, and also they will be with you for 15 minutes, as I said, and then at the end of the 13 minutes, we'll tell them that 2 more minutes left. Yeah. By the time at the end of 15 minutes, they will stop with you. Then the examiners and myself, my colleague, Dr. Murphy, will be asking questions. Yeah. During the time, while they're asking questions, they also may examine you, just to save the time, So don't get alarmed with that. They may talk to you and examine also. Yeah. And I think we have talked enough through that scenario, and you are well versed with that.
Yes.
And what we can do is, we want to examine you so that myself, my colleague will find out whether you have the appropriate sign, whether we are both are happy with what you have in your examination. Happy with that?
Thank you, yes, doctor, thank you.
Thank you very much.